Good afternoon and welcome to our County Health Rankings and Roadmaps webinar on breaking down the rankings model focused on tobacco and alcohol use. Breaking down the rankings model is a new series that we're offering this year, and we're going to go break down each of the health factor areas that are in our rankings model and go in depth on each one of those. Today we are focusing in on tobacco and alcohol use. My name is Angela Russell, and I'm the Community Engagement Lead with the County Health Rankings Project, and I am at the University of Wisconsin Population Health Institute, and we're broadcasting live from Madison, Wisconsin. Today, we are joined by Maureen Busalachhi, the Executive Director of Health First Wisconsin, and I have had the great pleasure of working with Maureen Busalachhi over the past several years and making sure that Wisconsin becomes a clean indoor air state. And so she's going to be joining us today and sharing her wisdom and expertise on her knowledge of tobacco and alcohol and what we can do to reduce the burden not only in Wisconsin but throughout the nation. So I'm going to read a brief overview of Maureen, a brief bio, and then we're going to go ahead and get started. So Maureen currently serves as the Executive Director of Health First Wisconsin, formerly known as SmokeFree Wisconsin. For a dozen years, Maureen has been working on public health policy issues, including advocating for prevention funding, the smoke-free air law, and raising tobacco taxes. Before that, Maureen worked with the Wisconsin Medical Society after her cutting her teeth on several political campaigns, and she also worked for the Wisconsin Association for Perinatal Care. She serves as an advisor to organizations including the Healthy Wisconsin Leadership Institute and Wisconsin Initiative to Promote Healthy Lifestyles, and is a mentor for the Wisconsin Women's Policy Institute. Maureen is on the board of her daughter's school's PTO and serves on her neighborhood association board. She is a frequent presenter at state and national conferences for public health and at the School for Medicine and Public Health in Madison and at the University of Wisconsin-Milwaukee School of Public Health. She's an avid biker, runner, and gardener, and she lives with her husband and her two young daughters here in Madison, Wisconsin. And she's also broadcasting live from Madison today as well. So Maureen, thank you so much for joining us. I am looking forward to doing this webinar with you. So,
thank you for inviting me.
No problem. So before we get into the specifics of the webinar itself, this is just a reminder for folks who are new to GoToWebinar. We are using the GoToWebinar attendee interface. On the left-hand side, you'll see the viewer window. On the right-hand side, you will see the control panel. And with the control panel, this is where you can interact with us, the presenters. And because of the number of people who are on this webinar today, we're going to be answering questions via the question log. My colleague Jan O'Neill will be assisting with answering those questions. And so if you have a question, go ahead and type it into the question log. Jan will either answer it or we will answer it during our time for questions and answers at the end of the webinar. We'll have a good amount of time left for Q&A. Also, if we do not get to your question during the duration of this webinar, we will be sure to follow up with you with an email response after the webinar. So again, if you have questions, go ahead and type those into the question log. So here's what we're going to talk about this afternoon. I'm going to provide a brief rankings and roadmaps overview. Then we'll talk about tobacco and alcohol. Why do we rank them? We'll talk about effective policies and programs. We'll talk about how can we be strategic in implementing those policies and programs. And then we'll talk about local examples here in Wisconsin. We'll wrap it up and then have some time for Q&A. So first, this is probably going to be a review for many of you, but if it's not, if it is, great, still stay on board and take a listen to this. And if it's is not a review, I just want to talk about why we do the county health rankings. So if you look down here at the bottom right-hand part of your slide, this is where we're trying to get to. Our whole intent is to improve health outcomes. Our tagline for the County Health Rankings and Roadmaps program is creating a healthier nation county by county. So our goal is to have improved health outcomes. So how do we get there? We used population-based data that we turn into the county health rankings, and we released the 2013 county health rankings on March 20th of this year. And those get a lot of media attention and the attention of community leaders throughout the nation, which then in turn develops broad community-based engagement And then with that broad community-based attention and engagement, we want folks to begin to identify and prioritize areas that or opportunities that they have for improvement, and then begin to identify and implement evidence-informed health policies and programs, again with the overall intent of improving health outcomes. Today what we're focused in on are specifically tobacco use and alcohol use. And we'll talk about some evidence-informed health policies and programs that either can be implemented or have been implemented in places across the country. So with the county health rankings, nearly every county across the nation receives 2 rankings. The first ranking is a health outcomes ranking, and we consider that to be a picture of today's health. The second ranking is a health factors ranking, and that's everything that contributes to the future health of a community, such as tobacco use, excessive drinking, access to and quality of health care, social and economic factors such as education, poverty, and income, and your physical environment. What's important to note about the county health rankings is that each of these rankings are within state rankings. So we don't rank the healthiest county in the nation or the least healthy county in the nation. These are within state rankings. So for Dane County, which is where Maureen and I reside, we are ranked within our state with our other counties throughout Wisconsin. So if you'll remember, we have 2 rankings. We rank on 2 things, the health outcomes ranking and the health factors ranking. This picture overall is our overall foundational model for the county health rankings and roadmaps program. We think that policies and programs, which you'll see at the bottom, influence, and policy and programs such as clean indoor air, influence health factors such as tobacco use, which over time influences health outcomes, so your mortality and morbidity of a community. And so with this model, you'll see the weighting that each factor receives. So health behaviors is weighted at 30% of our overall health factors ranking. Access to and quality of health care is weighted at 20%. Social and economic factors, 40%, and the physical environment, 10%. For health outcomes, we look at both mortality, which is weighted at 50%, and morbidity, which is also weighted at 50%. So you know that with the county health rankings, we provide data. We provide the ranking and the data that goes underneath the ranking for nearly every county across the U.S. So we've done the county health rankings now for 4 years. This is our 4th year that we release the data throughout the nation. In the first 2 years, the very first question that people would often have is, okay, I have my ranking, now what? What can I do with this information? That's when the idea of the county health roadmaps began. The purpose of the county health roadmaps part of the project is to provide information, tools, and resources to help communities throughout the nation to take action. And there are several components of the county health roadmaps. Number 1 is our Action Center. This is an online resource where you can look up on the different action steps of our Take Action cycle and learn what step you can take next to move forward in your community. If you need help prioritizing or assessing and prioritizing information, you can go to our website and find information on that. If you need help communicating your information, you can go to our website on the Action Center and find information about that as well. In addition to our online resources, we have 3 community engagement specialists here on staff at the University of Wisconsin Population Health Institute who are here to help to provide training and technical assistance and coaching. So if you feel like you're stuck and don't know where to go, you can connect with one of our coaching and coaching specialists and county health ranking engagement specialists online. Connect with them online, and they will help you take the next step. They'll either do some email coaching, phone coaching, and then in some cases we have provided on-site technical assistance and coaching. Another component of our County Health Roadmaps program is the Roadmaps to Health community grants. And we currently have 30 community grantees throughout the nation who are funded by the Robert Wood Johnson Foundation to focus their work on the social and economic drivers of health. So they're looking at early childhood education, they're looking at community safety, they're looking at a variety of things that really impact the health of communities from the social and economic perspective. In addition, we have the Robert Wood Johnson Foundation Roadmaps to Health Prize, and and I'll get to this in just a minute. These prizes are awarded to communities who are really doing a good job on the local level to work together to make change. One of the things that we often say at the County Health Rankings and Roadmaps program is that for a long time we've thought that public health just needed to be taking the lead. So we'd work in our public health silo, but we didn't really reach out to others and begin to include others such as our elected officials or our urban planters or business leaders in our work, in our efforts to make change. But we know, and Maureen's work with tobacco and alcohol really does exemplify the fact that it's by working together in a coordinated fashion that we really begin to make change. And these prize winners have done an excellent job of working together, and that's what their work is awarded for. And then we also have partner organizations as a part of our County Health Roadmaps project, and they are working with us to get the word out nationally as well. As part of our website on the County Health Roadmaps, we have a database called What Works for Health. What Works for Health is an online resource where you can look up evidence-based policies and programs. So, and I'll show you a couple examples of this later in the webinar, but if you wanted to look up what are evidence-informed or evidence-based policies and programs related to tobacco use, you'd go to this URL, click on tobacco use, and then you'd get a series of, or a list of various policies and programs. And with those policies and programs, you'd be able to identify which programs or policies are scientifically supported, which have some evidence, which are expert opinion, which have limited evidence or insufficient evidence. And this is a good resource for folks trying to look at how to move forward with different policies and programs, and if you want to know what's effective versus not. As I mentioned, the roadmaps to the Robert Wood Johnson Foundation Roadmaps to Health Prize. Again, they awarded their initial prize awards on February 21st of this year. We've got Santa Cruz, Manistee, Cambridge, Minneapolis, Fall River, and New Orleans. If you have not had a chance to look at the videos of these communities, I'd encourage you to do so. They're really inspirational, and they really tell you the story of how communities can begin to work together to make change. So the inaugural award winners were announced earlier this year. The Robert Wood Johnson Foundation has another call for applications that was released on March 20th. If you or your community is doing great work and you want to showcase what your community is doing, again, I'd encourage you to visit this website and consider applying. So far we have talked a little bit about the Rankings and Roadmaps program, and now we're going to go over tobacco and alcohol and why we rank them, and talk a little bit about the public health problem of tobacco and alcohol use throughout the nation. All right, here we go. So again, this is our County Health Rankings model. You'll see that tobacco use and alcohol use are both a part of our health behaviors component of the health factors ranking. So what do we look at for tobacco and alcohol use? We look at adult smoking, which is from the Behavioral Risk Factor Surveillance System. And then for alcohol use, we look at excessive drinking and motor vehicle crash death rate. So tobacco use. Our measure looks at the percent of the adult population that currently smokes every day or most days and has smoked at least 100 cigarettes in their lifetime. And we know that every year nearly 450,000 premature deaths can be attributed to smoking. And we also know that smoking is a cause of various cancers, cardiovascular disease, respiratory conditions, as well as low birth weight and other adverse health outcomes. So here's a graphic from the CDC. I mentioned that nearly 450,000 deaths are attributable to cigarette smoking, and then here is how this breaks down in terms of lung cancer, heart disease, pulmonary disease, other diagnoses, stroke, and other cancers. And what's interesting to me, Maureen and I were just chatting before we began, is that sometimes it's easy for me as a public health professional who lives in Madison, Wisconsin, where not as many people smoke. You've got clean indoor air. Restaurants are not smoking. It's interesting to me that when I travel, I'm like, oh, we still have a long way to go, or it's easy for me to take for granted the successes that we've had in smoking, that, oh, wow, this is still continues to be a big issue, and we still have a big battle in front of us as it relates to smoking. So this is important, and each of us have people that we probably know who've been affected by smoking as it relates to cancer or heart disease or other illnesses. So we do have a ways to go as it relates to smoking. And then this is a map that shows the percent of adults that report smoking more than 100 cigarettes and are currently smoking. Our data is from 2005 through 2011, and this is a county level map. So what you'll see is that there's still a high proportion of smokers here in the Kentucky area, West Virginia, Oklahoma. There are some areas of the country where they're not ranked because we don't have the data. But these aren't actual rankings. This is actual prevalence percentage of adults that currently smoke. So you can see throughout the nation we still have a problem. Those dark areas, that dark blue areas, that means that for the percentage of adults that smoke is between 24% and nearly 50%. So excessive drinking. What is excessive drinking? In preparing for this webinar, I thought that I would do a little quiz to look at my own drinking patterns, because I do like a glass of wine every now and then. So if you also want to take a quiz to learn about your drinking pattern, I'd encourage you to visit this website. It's called Rethinking Drinking. It's down here. It's provided by the NIH. It's really interesting. So the quiz is, what's your pattern? On any day in the past year, have you ever had, for men, more than 4 standard drinks, or for women, more than 3 standard drinks? So you think about it, any day this past year, Thanksgiving, New Year's Eve, your birthday, have you had more than, for women, 3 standard drinks? Yes or no? And then you think about your typical week. How many days per week do you drink alcohol? And then on a typical day, how many drinks do you have? And then if you click for feedback, it would tell you where your risk is in terms of being an excessive drinker. I just think that that's a fascinating little quiz. So what is excessive drinking? So binge drinking is more than 4 for women or 5 for men alcoholic beverages on a single occasion in the past 30 days. Heavy drinking is more than 1 for women or 2 for men drinks per day on average. So more than 1 for women or more than 2 for men on average. And we know that 80,000 deaths are attributed annually to excessive drinking. So here's our county by county map on excessive drinking. Again, a bit of an eye-opener here. So the state that I would say probably has the most area or most opportunity for improvement for excessive drinking, it looks like Wisconsin. We may have a problem here. Maureen, what do you think?
Definitely.
And then we've got some other states here that have a lot of dark as well. And then there's some other states, in contrast to smoking, are not as bad. So again, the darker areas, this map shows a percent of adults reporting binge or heavy drinking. The darkest area is where you have 18 to nearly 30% of adults reporting binge or heavy drinking. This other map that I wanted to show is also a prevalence of binge drinking among adults. Again, you'll see the binge drinking is much higher among the northern states as compared to the south, and high in Alaska and Hawaii. So again, there is a clear area and opportunity for improvement. Maureen, is there anything that you wanted to add about the excessive drinking before I talk about motor vehicle crash death rates?
Well, one thing I think is important to know is that binge drinking definitely contributes to a lot of other behaviors, drunk driving, crime, violence, being a victim of crime. And so it's really important to look at the big picture in terms of what binge drinking means. And we know that motor vehicle deaths MAD just came out with a report with people under 21, 30% of them die from motor vehicle accidents and alcohol. So that means about 70% of the alcohol issues and youth dying is not behind the wheel. So excessive drinking is a problem that really affects many different factors in our lives.
Thanks, Maureen. So on motor vehicle crash deaths, we include this as a part of our alcohol use. So this includes traffic deaths that include motorcycles, three-wheel motor vehicles, cars, vans, trucks, buses, streetcars, ATVs, industrial, agriculture, and construction vehicles, or bicyclists and pedestrians when colliding with any of the previously mentioned motor vehicles. We also know that 17,000 Americans are killed annually in alcohol-related motor vehicle crashes, and that binge heavy drinkers account for most of the episodes of alcohol-impaired driving. So here's what the motor vehicle crash death rate looks like across the country. In general, seems like there are more motor vehicle crash deaths per 100,000 population in the South as compared to the rest of the nation, but you also see pockets over here as well. And just to note, these slides are currently available on our website if you wanted to print them off and take notes, and this webinar will be archived for the future. So now I'm going to get ready to turn it over to Maureen to talk about effective policies and programs. But as I mentioned before, I wanted to highlight, if you want to learn about various effective policies and programs or learn the effectiveness of various policies and programs that you've heard about, I'd encourage you to take a look at our website, at our What Works for Health website, and you can get some additional information there. Maureen, you ready to talk about effective policies and programs for tobacco use?
You bet.
All right, great. Take it away.
Sure. So, of course, the first one I think is obvious to a lot of folks, smoke-free policies. And this, certainly has evolved over time, but we, I think, are in a place where you really need to make sure every workplace is covered with smoke-free policies. And in Wisconsin, we're starting to work on multi-unit housing, so where you've got, many families living in one building, apartments, condos, those kinds of things, making sure that those are also smoke-free, because if one person smokes in the building, we all smoke in the building. Making sure that cessation therapy is inexpensive, or reduced costs or even free, is a evidence-based approach to helping people quit and stay quit. Making sure physicians and nurses and health educators are kind of part of the system and helping people quit and stay quit and supporting them. Of course, tobacco quit lines have been a very effective tool as well. And one of the biggest motivators, of course, is money and price. So increasing the taxes on tobacco products and cigarettes is an extremely evidence-based way of going about reducing tobacco use, especially when that money gets thrown back into quit lines and prevention programs. We know that that's even more effective. And then funding comprehensive tobacco control programs is also a strong way to go about both the prevention side as well as the treatment side. In alcohol, I think probably most of the country does have a BAC law. In Wisconsin, it's 0.08. It's hard to get federal, if not impossible, federal highway funding if your state is not 0.08. So I think that's an important piece. There's been talk from time to time about changing the minimum drinking laws. There's a cultural myth out there saying that Europe does it better and they let their kids drink, but Europe actually doesn't do it better. They have lots of problems. They just have fewer traffic fatalities, I think, overall, just because of their strong public transportation system. But we need to make sure we keep the minimum drinking laws at 21. There is strong science showing that alcohol, when in the brain before 21, can lead, you have a higher percentage of leading to alcohol disorders. Breath testing or sobriety checkpoints are a very effective way of making sure people don't get behind the wheel and drive. So it doesn't necessarily deal with the binge drinking part of it, but it certainly makes sure that folks get home safe. Those have been shown to show about a 20% decrease in motor vehicle fatalities. Those who use, at least here in Wisconsin, and if they're above a 0.15 BAC, or a multiple offender for driving while intoxicated, ignition interlocks go into their cars. And those can be very helpful with that small group of repeat offenders, or those who obviously have a high BAC. Vigorous enforcement of current underage drinking laws, I can't say that enough. I think that's really important to make sure that we've got law enforcement working on the places where we definitely can. And we also know that it's very effective to do alcohol screening and brief interventions. And that can help a large group of people, which are really the binge drinkers, with how they're approaching their alcohol use. Of course, as well as help folks who have an alcohol disorder.
Thanks, Maureen, for that. Next, we're going to talk a little bit about Maureen's wisdom in terms of being strategic. Maureen has been at this for a while, and she's got some words of wisdom on you can have effective policies and programs, you can know what they are, but they're not going to get implemented unless you go about it in a strategic manner. There you go, Maureen.
Thank you. So I think the first thing is, so you get your rankings, you know where you're sitting, and you have to realize and really think about what is it that you want to do. What are your concrete goals? Is it raising a tobacco tax? Is it passing smoke-free air laws? Is it funding a tobacco control program? Is it working on alcohol laws? And a lot of these answers and questions can be pointed at either local or state government, so it can vary from state to state. We know that if we can reduce where people can use alcohol, where they see people using, well, actually this applies to both alcohol and tobacco, and the number of places where you can use it and make it expensive, you're going to see changes in behavior. So I think it's really important to, really make a plan, build the local support, and local can be your statewide community as well as, really drilling down into city councils and county boards. You need funding, of course, to do this work, and then I say go. And the funding piece, I think, is really important because a lot of what needs to happen in order to bring community change is awareness and education about what would impact the problem. So if people don't understand that you've got a problem in your community, you're going to have a really hard time convincing them that you want to make a change. But if they understand there's a problem and they understand that there are solutions out there, then you're, really pretty far down the road in terms of being able to make some change. The other important point is to determine who can make the change that you want to see. So for most of these issues that I'm talking about, it's really policy related, because when we're done making the policy change, we have left, hopefully, a permanent change in our communities. And, in Wisconsin, we know that I can't tell you how many bar owners have come up and said, I'd never go back to allowing tobacco use in my bar, even if I could. So you want to make this, but you don't want to rely on that. You want to make sure that it's a law and that it's enforced. So I think that's important as well. But you need to know who decides. And that's a really critical thing, because then everything that you're doing should be around moving the folks who decide. So is it a city council? Is it a county board? Is it, the state legislature? I also think you need local folks dedicated to this, and partnerships, of course. I think it's incredibly important to have public health working with the advocacy community, working with the healthcare community, working with, whoever makes sense in your area. In some cases it's unions, sometimes it's business people, sometimes it's both. There can be, faith-based organizations that can be great to work with as well. But you need that good local group dedicated to policy change. I remember back in the assist days we had poster contests and, some of those kinds of, awareness campaigns, but not really policy change. And when we started doing policy change, that's when we started to see the rates drop. So you need to make sure that you're, focused on the things that will definitely work. It's also important as you're planning to be strategic, as we've said. We all only have so much time in a day and so many dollars to do this work, and to think about organizing in your community. Here we use the Midwest Academy strategy model, and it's been really helpful for us in terms of helping us lay out what our plan is and where all of the partners fit in. In fact, every 2 years we do this plan with the State Health Department here in Wisconsin and the Tobacco Control Program, where we look at what do we need to be educating people about, what are the upcoming threats with tobacco use, what's happening, and then really roll out the who's doing what, and who can do what, because obviously there's cases where we don't want folks funded with government dollars to be lobbying, that's clear, but there's other partnerships that can get that part of the work done. And then I think you have to be really open about how industry may be trying to influence what's going on. And I've seen it many times where local coalitions have tried to bring in, some of the bar owners, for example, on smoke-free laws and try to work with them. And they also, worked with restaurants who had said, oh, we're smoke-free. I've never seen a single one of them testify in favor of a smoke-free law that affected everyone. So we haven't found industry to be helpful. I think you have to always be, especially when you're governmental funded, you have to sometimes have conversations or relationships with some of these folks, but they don't need to be part of your core group making decisions. Industry will try to change what you're doing. They will try to take enforcement out. They will try to weaken the policy that you're working on. Their interest, and you always have to keep this in mind, is profit. The more cigarettes they sell, the more profit they make. The more beer they sell, the more profit they make. So the next slide.
You ready, Maureen? You ready to talk about making it local and your work here in Wisconsin?
Sure.
All right. So just to prep for this slide, this is talking about Wisconsin's smoking ban, and I had the pleasure of working with Maureen and several of her colleagues several years ago in implementing the smoking ban, and Maureen, I think, is an expert in how to get this done at a statewide level and working with from the ground up. So I'm excited for her to share her story about implementing a smoking ban here in Wisconsin.
Thank you. So a lot of this started, of course, before I started working in this field, and I'm sure in your states the same is true, that there's been a lot of people who have started the path, or, and I know many folks on the phone have very successful states on this as well. But back in the day, in the 80s, there was the ASSIST program. In the 90s, the Robert Wood Johnson Foundation came in with a number of policies that they would help coalitions move towards, and that's when Smoke-Free Wisconsin wasn't formed in the 90s. It was formed in 2000, but started the idea about how do we move this forward. We had good policy research that if you can't smoke in a workplace, it reduces people's tobacco use. Raising the price of tobacco started to make a difference, and people were looking at comprehensive programs, of course. So in the 2000s in Wisconsin, we started seeing local laws coming down the pike, and we started with just restaurants, not even workplaces, but really just restaurants. And eventually we realized we needed to broaden that and make sure that we're covering all workers all the time. Because anytime you carve out an exception, you're leaving someone behind. And I don't think in public health that's where we want to do it. And so we kept, working on the local level, And sometimes we actually would go back into a community where we'd already passed a smoke-free ordinance and strengthen it. In the city of Madison, actually, that happened 3 times. In most of our local battles, we won by 1 vote. Most people think like it was really popular with lawmakers, but it really wasn't. The other thing that we learned, and there has been research on this as well, is that lawmakers are not going to vote for you if they don't believe that there's A, a problem, and B, that it's dangerous to be exposed to secondhand smoke. So if you couldn't convince them of those things, there was no way they were going to vote for the smoke-free laws. So again, going back to that health education and making sure people understand the risk of being exposed to secondhand smoke, and of course of tobacco use, is really, really important. So we're kind of rolling along, working in local communities. We're also working at the state level trying to raise tobacco taxes, and talking to lawmakers about the smoke-free laws. But some lawmakers get pretty irritated with us, and they decide they want to pull local control. And so they don't want local communities to be able to make the decision. Now, I'm sure some of the states that are on the webinar today are in that position where you're preempted, where you're not allowed to do local campaigns. And the Americans for Non-Smokers' Rights, which is a fantastic resource that I would strongly encourage you to get to know if you haven't already, says that it takes 17 years to undo preemption. So this was a huge threat in Wisconsin that the legislature was looking at preempting locals from going forward. And while we're listening to the testimony and frankly being lambasted by 2/3 of the committee, we heard the Restaurant Association get up and say that they wanted all their members treated the same. I think they had gotten tired of the local battles. And I thought, well, we better go talk to them. Now this is an organization that previously had web pages that were funded by Philip Morris. And really, we had pretty bad association with them. So it took quite a bit for us to finally start talking and meeting on a regular basis. And I think this is really an important part. When they signed on to what we wanted, we became partners. And I think from a public health standpoint, you always have to make sure you know what your deal breakers are before you go into those kind of negotiations. So if the restaurants had said, we want small restaurants exempted, or I don't know, ones with blue signs, whatever it would have been a no. But since they said we're all in, we started working with them. And it still took us a while to get the law eventually passed, but by dividing out the hospitality industry, that definitely helped us. And we just had the constant drumbeat of that work. And I know many of you are already on this, but every time a national report comes out, to the extent we have the capacity, we'll send out Swiss cheese press releases to locals so that they can again educate the community about the problem, and try to get some statewide coverage as well on those. And I can't, the relationships between the state health department and local health departments is absolutely critical. There's no way that advocacy groups can do this work on their own. And so, those partnerships were really important, and we were really, and we still do, work very closely with the state health department. And in fact, we do receive some contracts for funding. And those of you that are involved in public health, I would strongly encourage you to look at funding organizations that can help you provide education and that also may have some freedom, because that is, I think, a wonderful relationship. It also brings credibility to the advocacy organizations because they're working in public health. So, as things started to move on, our partners at the national level, ANR, TFK, of course, the Campaign for Tobacco-Free Kids, really helped us out quite a bit. And, in about 3 years' time, we raised tobacco taxes twice. I believe we're 8th in the country on cigarette taxes, and we have the highest, I think, moist snuff tax. We have to close another loophole, though. It never ends. Chocolate flavored candy little cigars in our state are super cheap, and there's a loophole on the tax that we're trying to fix. But anyway, within those years, we were able to pass two tobacco tax increases and get the smoke-free law through. Now, a couple of words about that. The smoke-free law is great, but because there was some give and take on the local level, we did not get the strongest possible law. So if you look at the slide, you see this guy, he's smoking right outside the bar. That's a problem. We did not get a perimeter put in. So you can only pass at the state level your strongest local laws, but not your last strongest local law. It's got to be many of those local laws that have really clear barriers and that kind of thing. So, and then as a segue, if you look at the nice sign about the Pabst can plus a shot of whiskey for $5, it's pretty cheap. So going to the next slide.
That's a perfect segue, Maureen. So now she's going to talk about the other big problem that we have in Wisconsin, which is the burden of excessive alcohol use. Go ahead, Maureen.
Right. So, well, just a quick word. From 2001 until 2012 on tobacco use, our high school rate has dropped more than 50%. There's an estimated 250,000 people in Wisconsin who used to smoke who don't anymore. So we have not only passed laws, but we have moved the dial, which is what I wake up every day wanting to do. We have changed the statistics on smoking in Wisconsin. So we kind of got that crown jewel, which is that smoke-free air bill, but there's still more to do in tobacco, of course. But we started looking at where are other places that we could find this synergy with partners and with public health, and what are our problems here in Wisconsin. So we worked with the UW Population Health Institute and just asked the question, what does it cost us? And this burden report is mind-blowing. This isn't about, you know, in our state we have a lot of local brews. This isn't about having one of those or a glass of wine with dinner. This is about, on average, 9 drinks per occasion, 4 to 5 times a month in Wisconsin. 25% of the population, adult population. So we have a big problem. I believe we also have more bars than we have grocery stores. So we have a lot of alcohol outlets, a lot of retail, a lot of bars, and a very strong tavern league. So there's been attempts in the past to change the alcohol culture in Wisconsin. Unfortunately, it hasn't really moved the dial like we would like to see. There's definitely been some local success and some success with youth. One of my favorite stories is, well, on the one hand we paint a pretty bleak picture of what's going on and is going on in Wisconsin. We also know that in Two Rivers, small town, their city council used to buy barrels of beer for the senior graduating class of the high school. They were the first community in the state to pass the social host ordinance, which is quick penalty for any adult who gives a minor alcohol. So definitely seeing a big change there, and we're seeing youth alcohol rates drop as well, which is really important. I mean, and obviously both of these can lead to other drug abuse as well. So what we thought is it would be really important to change the conversation about alcohol and take it kind of in a way away from the Tavern League and look at what does it cost us. And we collect 1% in alcohol taxes compared to what it costs. So this is not a cost-benefit analysis, but this just looks at, you know, what goes on when people use alcohol. And the other piece that I really liked is that we pulled out how much is taxpayer-related versus how much is the individual and their family, employers, healthcare, you know, that kind of thing. But what are taxpayers paying for this quote-unquote party? And in fact, one of the alders in the city of Madison, you know, kind of commented on the report, and to paraphrase him, he said, well, basically that's what it costs to party, which I think most taxpayers in Wisconsin would not think is a good idea. So we have a pretty tough road to go on alcohol, certainly in our state. But I feel good about some of the work that we've done in tobacco. I feel really good about a lot of the action that's going on in both alcohol and tobacco on the local level. Because without that local connection, without those local folks meeting with their city councils, with their state legislators, I don't think there's any way we can really make the kind of full-scale changes that we want to see. And sometimes we also have to make sure we've got partners out there that speak a little different language than us. So there are times that it's appropriate where business owners, can come forward and talk about the cost of doing business and the environment that they're living in when we talk about, workplace wellness and keeping employees healthy. I think that also has a different frame. So when you put it in dollars and cents, legislators start to pay attention. But of course, you need to be able to illustrate the whole problem to them, and being able to tell stories, I think, is incredibly important.
Thanks, Maureen. So I'm going to wrap it up a little bit, but now is the time that you can enter your questions. We're going to have some time for Q&A with Maureen and myself, and generally these are my favorite parts of the webinar because we get to hear from you, what you're thinking. If you have any questions about the content of the webinar that was presented here, or you just have questions about how did Maureen go about doing what she was doing, are there things that worked, are there things that didn't work, now is the time to go ahead and enter those questions into the question log, and hopefully we'll have some good dialogue. So just to wrap up, a couple of things. Number one, as I mentioned at the beginning of the webinar, one of our mantras here at the County Health Rankings and Roadmaps program is that it's by working together that we can make change. Maureen mentioned working with business, working with elected officials, both at the state level and local level. It's really important that we work together in a collaborative fashion to move the dial. So if you look at here the health behavior section, this slide is just showing our different health factors and potential partners. If you look at health behaviors, we have faith leaders, community leaders, policymakers, advocates, educators, and other key folks that you may want to consider working with. I wanted to highlight a couple upcoming webinars that you may be interested in. Next week, next Tuesday, we are starting our partnership series. How do you begin to work with partners? And this partnership, to kick off the partnership series, we are having a webinar focused in on starting the conversation. And then on May 7th, we are having another Breaking Down the Rankings Model webinar focused in on sexual activity. There are several ways to stay connected with us. You can follow us on Twitter. Our Twitter handle is @CHRankings. You can like us on Facebook, and if you're not already on our e-newsletter list, feel free to shoot us an email here, and you can get on our e-newsletter list. Before we have time for Q&A, I just want to acknowledge all of the work that goes into producing the County Health Rankings and Roadmaps program, and to thank Maureen for joining us on this webinar. So thank you all for joining us. Now is the time for Q&A, and I'm just going to start off with a question for Maureen. Maureen, how would you recommend translating tobacco statistics in a meaningful and effective way to policymakers?
I think there's many ways to do that. In our state, the American Cancer Society and the Department of Health every 2 years put out a burden of tobacco disease report. And so they look at, how many people are dying from tobacco use, what are they dying from, what is the rate of disability because of tobacco use, and those kinds of things. And so it shows both the medical expenses as well as the lost productivity. I think that's an effective tool to use. We also do that kind of like the county rankings on a county-by-county basis so that you have a local instrument to use. And while in many cases that's not local enough for state legislators, it really gives them a very good picture, of what's happening in their community. We've also do work with our quit line, and every 2 years they produce for our state legislators how many people in their assembly districts and in their Senate districts have called the quit line. So I think that's helpful in terms of, people are using this service, and that it's helping them. The thing is, we have a ton of statistics in tobacco, and I think it's really important to educate lawmakers about that. But the thing that's going to stick with them, because we're all human, is the stories. It's the stories about the nurse holding the patient who's passing away. It's the stories of the, frankly, younger parents who are, struggling with health issues or of children who've lost their parents way too young because of tobacco use. Those are the things that are going to, actually put it over the top. They need to understand that it's a drain in our economy and that it costs a lot of money and it impacts people's, length and quality of life. But they also need to know the faces of the people who are adversely affected by it.
Okay, great. Thank you. Here's another question about changing cultural norms. I see that in Wisconsin it's a cultural norm to drink. In other states it's a cultural norm to smoke. How do you begin to change cultural norms?
That's a very difficult question. I think, some of the important pieces are, again, having those local coalitions that are out there doing some of that education. And as you raise community awareness and move people towards community action, you'll start to see, I think, change that is, starting to happen towards people's attitudes. But it's really helpful to get tobacco out of every workplace because it changes, it really significantly changes the norm. Raising the price, even talking about raising the price on tobacco or alcohol, I think is a really important thing, and to kind of show people that there's a better way of doing things. But it's a long process, and the CDC has actually put out a brief on the effectiveness of local community coalitions and how they really impact change over a long period of time, and that's why sustained funding is so incredibly important. In that, I think, coupled with really strong partnerships in the advocacy, business, health community, really starts to move the ball. But back in 2000, we had like a 36% high school smoking rate, and now we're down to 13%. So it can definitely change, but it does take a sustained effort to do so.
Great. Thank you. Here's another question for you, Maureen. Can you elaborate more on the role of providers related to effective policies and programs? Can you speak more about educations of clinicians as part of strengthening infrastructure? What specifically should providers be educated on? Just reminder systems, or are there other things?
Well, they need to, of course, know the 5 A's in terms of tobacco use, and SBIRT, the short, brief, informational interviewing, I know I'm missing a letter in that acronym, is also a very effective strategy for alcohol use. So there's a lot of resources available. I know the Center for Tobacco Research and Intervention at UW-Madison has a lot of those materials that you could pull for employers, for providers, and of course for tobacco users. That would be very helpful in, it's not state specific, of course, in terms of helping people do that. The other piece of providers is it is extremely effective, and I don't think we ever ran a campaign where we did not have a physician speaking, at a public hearing or to the press about these issues. They're the ones that have the stories. They have a lot of respect in the community, and I think it's incredibly important to keep the healthcare provider folks engaged. I know they're all, at least here, they're very distracted with all that's going on with healthcare reform and that kind of thing. But when you get into especially your primary care providers, you find them very passionate about helping people quit and quit for good. And when you show them what you can do in policy, I've had my own family doc has told me, he said, I could spend the rest of my life counseling smokers every single day, and he said we would not impact as many people as changing the laws have. So a lot of them really do get that, and you got to work from the bottom up and the top down in order to make those changes. So making sure your provider community is well attuned and has that kind of training is really helpful, and it's also helpful for policy.
Thank you. We've got another question for you, Maureen. Can you provide some information about the alcohol license density ordinance in Wisconsin and how that's going to be affected this July?
So in Wisconsin, alcohol is regulated mostly on the local level, and so in Madison, Wisconsin, there is an alcohol density ordinance kind of just in our downtown area. back in 2007, 2008, there were a number of violent crime incidents that finally got the city to wake up and realize they shouldn't give bar licenses out to everybody who applies. So it's sort of stemmed the flow a little bit, but we still need to remain vigilant in order to keep that policy in place, because I think people get complacent when they don't see high violent crime when they made the change. But we're also trying to provide the tool that there's a huge cost to having as many bars as we have here in Wisconsin. In Wisconsin, I think we have about 3 times the normal or the national average for alcohol outlets. So density ordinances are incredibly important, and in some states those are regulated on the state level, and some states they're regulated on local, and some of them they kind of have a combination of both. But my local bakery sells beer, so here it's almost like having a business means that you have to have a liquor license, and that's a hard mindset to change, but one that we need to do.
Here's another question for you, Maureen. Do you have examples of counties or states that have worked effectively to reduce alcohol-related motor vehicle crash deaths and injuries?
I'm not an expert on what a lot of other states have been able to do. I do know that there are strong examples showing that consistent sobriety checkpoints along with saturation patrols, which means you hang out the places, the police force hangs out at the places where they know there's alcohol crashes and looks for vehicles that are swerving and probable cause. The beauty of sobriety checkpoints is that it warns people ahead of time that, hey, there's going to be a checkpoint, at the corner of, the on-ramp on the freeway where everybody needs to go to get to the game or whatever, and gets people to prepare and make changes or have a designated driver or take a taxi, whatever they need to do so that they don't drive drunk. Now the Tavern Lake here will say that they're not effective because they don't catch very many drunk drivers, but actually that's the whole point, is to not catch the drunk drivers, but to make sure that people aren't driving drunk. And then you see the significant decrease in motor vehicle crashes. So I think that's effective. We know that higher taxes are helpful because price matters, and it especially matters with our young people and with binge drinkers. So you start increasing the price of those products, people use them less. They also become less valuable to hand out to kids. So that's why having high alcohol and tobacco taxes makes a difference, because those products become more valuable and they're less likely to give them away.
Thanks. So I think we have time for a few more questions here. If you have a question, go ahead and enter them into the question log. One question that we have, Maureen, is non-political things. Are there things that strategies that we can implement to improve the entire community that are not political?
That's a great question, and I think, there are some things that are. I think your biggest bang for your buck probably does involve an elected body. But a lot of what we were talking about before in terms of the provider community and making sure they're well educated can be very helpful. They can also be great allies in the political fights. I know there's a number of education programs that are evidence-based. I would just always make sure that you're really checking the evidence base in those programs. Showing car crashes to kids has not proven to have a lasting impact. The kids who are unlikely to do those things, probably can be impressed by those, but over time you need to make sure that you're really evaluating your programs and making sure that, that programming is there. I also think that there's different roles for different people throughout the whole system, and with public health and that kind of thing. So by doing the best job you can do, if your job is to educate providers on how to help people quit smoking, that can feed into the other kinds of changes, I think, that make a big change. But you need all of those systems in place. When we worked to raise the tobacco tax here in Wisconsin, it was incredibly important to us to make sure that there was funding going back into the Medicaid program and that Medicaid covered cessation services to a really high extent so that people could get help. So making sure those ends of the system kind of connect are really important. But there's a different role for different folks to play, and play those well, get people excited about helping people either on an individual or a policy, population basis, they can work together. But a lot of this stuff is political, and that's just, it's political because the other side makes money every time they sell, and especially oversell, in the case of alcohol. So we need to always kind of keep that in mind, that there is another side to this.
Thanks, Maureen. We've got one last question in, and then we are going to sign off. This last question is, I'm very interested in the relationship between tobacco use and drinking together. What are your observations on the relationship between the two coexisting in the same communities?
Well, there's definitely, triggers that folks have, and we've learned, with the mental health community and the addiction community, that if you're going to successfully treat someone, you should treat all of their addictions at once. So you need to deal with not only their alcohol use, but their tobacco use. And so I think there's things that happen in the brain, and I don't pretend to understand all of this. It's just what the researchers and experts tell me. That even if you manage to stop drinking, if you still smoke, you can actually end up triggering, some of the drinking-related behaviors. So it's really important, I think, to treat all of those things. And we're still working on that. There's a long way to go here in Wisconsin. But we've seen, some very, big success. One of the recovery houses that has pregnant women and babies have gone for over 7 months now without a premature or asthmatic baby, and that never happened before they went smoke-free on their entire campus. So it definitely can have an impact. In terms of those behaviors existing together, heavy drinking, heavy smoking definitely have a high correlation. Heavy smokers often, not always, obviously, are alcoholics and vice versa, so there definitely is, a correlation between the two of them. And I think in Wisconsin, that's why the bar owners were so afraid that they would lose business, is because all of the smokers would leave. Of course, the smokers have come back and they just step outside, and bars are doing, I don't know how to say this, but I guess very well in Wisconsin. So the alcohol industry continues to be strong here.
Thank you, Maureen, and thank you all for joining us on this webinar. Maureen, as you can tell, is an expert in this. She knows how to work effectively with legislators and with local communities on how to make change, and she's done a great job in Wisconsin. As you can tell, particularly with our excessive drinking, we still have a ways to go, a lot, but with Maureen's leadership and her work alongside of others, I'm sure that we will begin to make progress. And if you all have questions related that you think about after the webinar, feel free to shoot us an email at chr@match.wisc.edu, and we'll respond to you. Thank you again for joining us on this webinar. I hope to see you on future webinars. And Maureen, thank you so much for being our guest speaker. Take care, all.